Good afternoon, grade 5. Yesterday, we learned about the first aid principles. Today, we're going to learn about the basic first aid for common injuries and health conditions. Injuries refer to all kinds of physical harm that happens to any part of the body. They are commonly caused by accidents. Accidents are unfortunate incidents that happen unexpectedly to anybody, anywhere, at any time. It can happen in school, at home, at work, or at play. The best way to avoid accidents is by keeping safe at all times. The following are some common injuries and health conditions and the appropriate first aid treatment that can be applied to each. Wound. Wounds are injuries to the tissues. They manifest as breaks in the skin. Different types of wounds include cuts or laceration, scrapes or abrasion, avulsion, and punctures in the skin. The video that you are going to see is the first aid for wounds. First aid for wounds. Apply direct pressure on the cut or wound with a clean cloth, tissue, or a piece of gauze to stop the bleeding. If blood soaks through the material, keep applying pressure and put more gauze on top of it until the bleeding stops. If the bleeding wound is on any of the extremities, like hands and feet, keep the affected part at a position higher than the heart. Doing so could help slow the bleeding. Remember to stop the bleeding before washing the wound. When the bleeding stops, gently clean it with soap and warm water to prevent irritation. Apply an antibiotic cream to reduce the risk of infection and cover it with a clean bandage. Change the bandage daily to keep the wound clean and dry. Next is nosebleed. A nosebleed occurs when the blood vessels in the nose break and bleed. Most nosebleeds pose no serious harm or medical condition if they happen infrequently. Some common causes of nosebleeds include foreign objects stuck in the nose, allergic reaction, chemical irritants, a nose injury, a result of picking the nose, repeated sneezing, cold air, upper respiratory infection, and large doses of aspirin. Ask the person having a nosebleed to sit upright and lean forward. Lightly pinch the nose using the thumb and index finger to pinch the nostrils. Ask the patient to breathe through the mouth. If the bleeding does not stop after 10 to 15 minutes, keep a constant pressure for another 10 to 15 minutes. If bleeding persists, seek professional medical help. To prevent the bleeding, do not pick or blow the nose. Do not tilt the head down soon after the bleeding stops. Applying a layer of petroleum jelly to the inner walls of the nose can help prevent rebleeding. Next is insect bites. Insect bites are mild and usually manifested by redness, itchiness, stinging sensation, and minor swelling of the affected area. To care for an insect bite, do the following. First, move to a safe area to avoid more bites or stings, especially if the bite was from a swarm of bees or hornets. If possible, remove the stinger, and then wash the area with soap and water. Apply a cold compress to reduce pain and swelling. A towel wet with cold water or an ice pack may be used. If the sting is on an arm or a leg, raise it higher than the heart. Apply an insect bite cream to the affected area to help control the pain. If an insect bite cream is not available, use baking soda mixed with water to make a soothing paste and apply it to the itchy skin. And last, the signs and symptoms of an insect bite or sting normally disappears after 1 or 2 days. If the reaction persists or becomes severe, consult a doctor. Animal bites. Bites and scratches for animals. The first aid for animal bites. First, wash the area with soap and running water. Next, apply pressure using a gauze or clean cloth if the bite is bleeding. After that, when the bleeding has stopped, cover the area with a bandage or gauze, and then go to the nearest hospital for medical attention. For burn and scald. Burns and scalds are damage to the skin caused by heat. A burn is an injury caused by dry heat, such as fire, any hot material such as cooking utensils, or even the sun. A scald is caused by wet heat, like steam, hot water, or cooking oil. Burns and scalds are treated differently from other types of wounds. Burn units even exist in hospitals to take special care of burn patients. Food poisoning. Food poisoning is a foodborne illness. It occurs when the food or drink consumed is contaminated with bacteria, parasites, or toxins. Any of the following first aid may be administered to food poisoning victims. First, give the patient lots of water to keep the body hydrated. Next, have the person drink a glass of warm water with a few drops of lemon juice and a pinch of sugar and salt. Let him or her eat light, bland food items such as crackers, bread, plain rice, or bananas. Let the person take a tablespoon of honey mixed with a few drops of ginger juice. This helps to reduce inflammation and pain. Let the person take basil leaves juice early in the morning on an empty stomach to help in digestion. And lastly, if vomiting and diarrhea last for more than 2 days, take the patient to the nearest hospital for medical attention. Fainting. Fainting is a sudden and generally temporary loss of consciousness due to lack of oxygen in the brain. As blood supplies oxygen to the entire body, fainting occurs when the blood supply to the brain becomes inadequate. This is usually due to dehydration, heat exhaustion, low blood sugar, and sometimes even emotional stress. These are the things that one can do when somebody faints, including the following. If someone feels like fainting, tell him or her to lie down. Raise her legs by placing their ankles on top of her shoulders to help the blood to flow back to the brain. People who faint generally look pale. As you raise their legs, watch their face the signs of recovery. Make sure that the patient have plenty of fresh air. Give enough space for the person to breathe. And if the person do not regain consciousness after some time, open the airway, check the breathing, and prepare to give CPR. When this happens, call for professional medical help. So these are some basic first aid for common injuries and health conditions. Thank you for watching. God bless.